Hey folks, Doug Blake with Body Design University. In this video, I want to go over an area, pretty interesting area in chapter 8, and this is on page 265, and it's related to the physiological adaptations to steady state and interval-based exercise. And it relates to figure 8.8. So this is a improved exercise capacity figure, along with the improved exercise capacity related to lactate threshold. The kind of the point of the video is I want to kind of resolve some issues that I've heard from students, maybe not resolve, but just to answer the questions and resolve the confusion that y'all may have related to steady state and interval based type of exercises. So high intensity interval training, just as a, for instance, by the way, there are any number. HIIT training is not the only way to do progressive interval type of training. There's even moderate intensity interval training. There's any number of ways you can, well, I shouldn't say a whole lot, but there's a number of ways you can do interval training. HIIT training is kind of the flavor of the month, and there's nothing wrong with it. It's absolutely beneficial, but there's also some confusion, misunderstandings related to it. So in response to some questions I get from students about this specific area, it's kind of important to understand what ACE is explaining to you, and what has come out even more recently. It's one of the first things I want to just tell you when it comes to this topic. You have a textbook, and for the most part, it's a great textbook, great information. But remember, once a textbook comes out, once it is published, it is for the most part, or at least some of the material for the most part, is already outdated. Okay, remember, there's research being conducted in these very areas of exercise physiology, kinesiology, biomechanics. All the time, there's literally studies, and at the time of this video, it's 2024, it's February in 2024. There have been research studies conducted over the past 10 years that are not notated inside a particular textbook. Doesn't mean that the material per se is incorrect, but we have to, as exercise professionals, right? You know this already, and Ace will tell you this. We have to always keep in mind that just because we read something in a textbook doesn't mean it is the most accurate and up-to-date information. I'm just going to tell you, because ACE does this a lot. And it's good that they do this. They provide research. They back it up with research studies in each of their chapters, and they will do a standard in-text notation when they get to a particular area. And that's why on page 265, chapter 8, it's a good idea, take a step back and understand a little bit about what they're not able to tell you, so much as because of the new sort of updated research. It hasn't changed much, but we have to be careful that we don't just dogmatically say, okay, steady state is this and high intensity interval training is better and steady state is whatever the case is. We want to be careful, and I want to help you with that, because when you read through the materials, you're going to notice that ACE is giving you data research from 2013, sometimes even prior to 2000. Remember what I said? It's 2024. It's February 15th, 2024. There were research studies conducted a year ago, right, that provide additional updated information. Again, I'm giving you what they're telling you. Remember, you're going to take their exam, but you got to take a couple of side roads here to know what's actually happening in the field of exercise science and research. And so I was asked some questions, because I know students are pretty smart, and they're, maybe you even are going online and you're checking your Google, you Google this information, you see some really, really interesting and very smart individuals on YouTube giving information that may contradict a little bit about what you're reading. So you do need to know there's nothing wrong with this. That is the normal progression of science, is that what they knew in 2013, just as a for instance, may have a little bit of different nuance in 2023. And so I've had a number of questions as to, as simple as, which is better, steady state or HIIT training? There is no better way. They both have their benefits, and that's why I wanted to kind of explain this. So just so you know that in the cardiorespiratory training sort of realm, one of the things we're always looking for, now this is from a research perspective, is the increase in sort of physiological biomarkers such as VO2 max, lactate thresholds. Sometimes we've used the term anaerobic threshold, and the ability to train at higher and higher levels of intensity without falling into you know, some level of acidosis in the blood due to lactate buildup. And so these are really important points that we want to look at. And again, I just want to kind of go over here with you figure eight, pretty straightforward information. This hasn't really changed a whole lot. We do know that in general, detrained individuals, once they start a cardiorespiratory training regimen, by the way, it doesn't matter if it's quote steady state or HIIT training, it doesn't really matter, but detrained individuals, for the most part, if they do anything, they're going to generally increase these what we call biomarkers, these two variables that indicate increased physical capacity, right, from a cardiorespiratory perspective. And that's all these two figures are showing you. Percent improvement from baseline, percent improvement from baseline, improved exercise capacity, and exercise capacity as far as VO2 max and lactate threshold. Generally, VO2 max, because there's a genetic component. There's some folks who already have a relatively high VO2 max. That is the ability of the body to get oxygen basically from the air into your lungs, into your circulatory system, to the working muscles. The general understanding, it's not always correct, but the general understanding is that the higher the VO2 max, then maybe, maybe you'll have a higher cardiorespiratory capacity. Now we're talking about from an athletic perspective. Not everybody with high VO2 maxes are incredible cardiorespiratory athletes. However, we know that the strongest athletes from a cardiorespiratory perspective, so cross-country skiers, marathoners, they tend to have fairly high VO2 maxes. I mean, I don't know any of these high-level Olympians or high level long distance track and field athletes that aren't in the 70s, 60s, 70s, 80s. I mean, some insane VO2 maxes. But what we do know is that there is a genetic component to this. And so if you're detrained, right, you can actually increase your VO2 max, but there is sort of a stabilizing point where you reach, I guess you could say, your sort of genetic potential. Again, it depends on the training, depends on the individual, but roughly what this is saying is that roughly within a half a year, 16 week, excuse me, 4 months, 5 months, yeah, roughly half a year or so, you can make some increases, significant increases if you're detrained. And then your VO2 max will for the most part max out. It's not 100% correct. We can increase and continue to increase VO2 max, but there's other variables in play, such as reducing overall body weight, training strategies, but you're just not going to see these drastic increases. And by the way, these two figures that you're seeing here are based on steady state training programming. Okay. If I do interval type of training, I do lactate buffering type of training with an athlete, I can inch up their VO2 max. But at the end of the day, it's only one variable. I can still have an athlete with a lower VO2 max and still get the gold. and still beat out another athlete based on these other variables. One of them, of course, is improved lactate threshold, lactate buffering, or upping their threshold at which lactate can be basically endured and dealt with through the circulatory system, and the buffering systems within the your circulatory system, so, and the liver and whatnot. So lactate threshold roughly reaches a max. Okay, it never truly maxes out. There's still incremental increases that can be made, and that's what ACE is going to tell you. You can actually see sort of long-term, but very, very slow increase gradation of lactate threshold. Of course, at some point, you're going to have to do some very targeted, specific lactate buffering training. Now we're talking about 95% max heart rate for interval type of training. And then individuals can kind of continue. So that's what that particular chart figure is showing you. And again, figure 8.8. So that's what ACE is saying, that your lactate threshold can continue to improve for a much longer period of time. We're looking, I mean, this is weeks. By the way, I should correct myself on that original. I was talking about months. 16 weeks, you're hitting, so roughly 4 months. Okay, I said like half a year, but 4 months. Here we're talking about fairly straight, significant increases in lactate threshold, increases up to 24 weeks, right? So what is that, 6 months? Yeah, that's 6 months. That's half a year with continued increases. And again, these are averages based on steady state training. Kind of the last thing to go over with you on this page 265, 266, is that there is more to this. I hate to say contrast between steady state cardio training and HIIT training. I hate to, you know, contrast. Look, I'm happy when clients are training, right? From a pure personal training perspective, I'm just happy that my clients are doing more than 3 days of cardio. Honestly, if they like to do, quote, steady state, which means getting their heart rate up to a certain level and maintaining that for 30 minutes, I'm cool with that. I'm happy with that. And if they tell me, I just don't like doing that HIIT training, hurts my knee, my ankles, don't worry about it. Let's just get your heart rate up. And I'd love for you to do it 4, 5, 6 days a week. From a purely training perspective, I'm not talking about athletes whose job it is to train. I'm talking about the average person. Let's keep that in mind, who your market is and who you're dealing with. The average person, they're lucky that they're actually coming in and training with you. If we need to change up the methodology of their cardio training to suit their desires to continue to do it on their off days, you do what you got to do. Don't tell people to do the treadmill if they don't like the tread. Just get them to do more activity on their off days. That leads us then to the reality of steady state or HIIT training. Doesn't really matter in a sense. By the way, HIIT training, high intensity interval training, is not necessarily better than steady state training when it comes to either caloric deficits, right? Burning more calories, or the only thing that really it has some benefit if it's done correctly is that it can jump and boost lactate buffering because you're getting your heart rate up higher. And here is the reason. It's all with how you're actually doing your HIIT training. The idea with HIIT training, of course, is that you're going to do a certain amount of time at a certain heart rate, and then periodically, it doesn't matter, every minute, whatever the interval is going to be, is now you're going to get their heart rate up. That's great. If my heart rate is at 130 and I jump it up to 150 or 160 for 30 seconds or 20, whatever the case is, that's really beneficial to my cardiorespiratory system. It's very beneficial. But what happens quite often, and this is where the problem comes in. Most folks, when they do their HIIT training, they get their heart rate up, which is great, but then they let it go down too low. Now, just keep in mind, just because I got my heart rate up doesn't mean I'm going to, at the end of a 30-minute workout, burn more calories than steady state. You just got to do the numbers. When it comes to HIIT training, here's the little tip I guess I'm going to give you is when you get your heart rate up, don't let it go back down too far, because you will lose the caloric burning capacity that you're getting at a steady state level. Remember, if I keep my heart rate at 140 beats per minute, I'm burning this many calories for the length of time I'm doing it. That undulation of intensity, you could technically burn more calories than the steady state, but the undulation, meaning the up and down of heart rate, needs to be at a threshold level. In other words, you can't let your heart rate go too far down, right? Because then the caloric burn may not be the same as if you did steady state. So just keep that in mind. There's a fair amount to it that we could go into, but the whole point of this video was to kind of explain a little bit about figure 8.8 and to let you know that it's a good idea to look at the dates that these research papers are that they're using, right? Look at the dates: 2013, 2008, 1998. Doesn't mean that it is bad information. However, research is being done every day. Research papers are being pumped out every day. And to deal with high intensity interval training versus steady state reveals a little bit more than just high intensity interval training is better than steady state. No, its benefit is, as I said before, lactate buffering capabilities tend to be better through HIIT training protocols. Absolutely, because you're getting your heart rate higher. But there's research that's come out fairly recently where if they, truth be told, if you're letting your heart rate go down too low, you are not establishing a caloric burn the same as a steady state. And remember, steady state can be at any heart rate. Now, we normally talk about moderate intensity, but what if I keep my steady state at moderate to higher level of intensity where I'm really working hard? I'm burning a lot of calories then versus steady state, but at a lower heart rate, right? Technically, they're both steady state, but one has a pretty high caloric burn. And what if I do high intensity interval training, right? Where I only do my high intensity interval for 5 seconds. I blast it out for 5 seconds and then I let my heart rate come down. Well, is that HIIT training? Technically, yes. But you do the numbers and I can look at my caloric burn and I can have significantly higher caloric burn with a steady state protocol than with a high intensity interval training protocol. Got to be more precise. That's what I'm telling you. As a trainer, if you're going to do this and you're going to talk about it, you need to be precise. Okay, not only with the language that we use when talking to our clients, but we need to be precise as to exactly what we're talking about from the protocols that we're looking at. So, in conclusion, just make sure that when you're going through chapter 8 and you're reading through this, ask the questions that you need to absolutely in the comment section. If you want to know more about this, just let me know. More than happy to reach out and do more content related to this. Keep in mind that we would love for you to subscribe, click the like button. Let us know if you understood this, if this was a helpful video by writing the word understand. And of course, as always, let us know if there's more information you need on this or any other topic that we do cover. Remember to head over to our Facebook group. Okay, it is a private group for those individuals studying their ACE to pass their ACE CPT exam. As always, have a great weekend, great week, and we'll see you next week. Thanks.